Jonah Comstock, Editor-in-Chief of Pharma Forum. I'm here at Bio 2025 in Boston, and I'm joined by Dr. Raza Bokhari, the CEO and Executive Chairman of Medicus Pharma?
That's correct.
Thank you for joining me this morning. And tell me a little bit about what Medicus does and why you're here at Bio today.
Thanks, Jonah, for making some time in your busy schedule. We're very excited to come to Bio. Bio is the place. It's a rite of passage. We all have to, as an emerging growth company, come and meet old friends and try to make some new friends in the space. This year, especially promising for us at Medicus Pharma. We are just coming off a NASDAQ listing in November of last year as an emerging growth company with our lead asset, Skinjet, that is focused on bringing to market a novel, non-invasive treatment alternative for basal cell carcinoma of the skin. Something that we are very happy that is getting a lot of attention. I had a standing only room for our presentation, so that was very reassuring and exciting for us.
One of the things that makes Skinjet interesting is the delivery mechanism, right?
That's true. It is the holy grail of skin diseases, which is the most it's the most largest organ of the body, 25%, and there is a quest to deliver therapy directly to the skin. And we, through our uniquely designed, patent-protected microneedle arrays that come out of Carnegie Mellon and University of Pittsburgh, have these cellulose-based microneedle arrays which are microdosed with a known chemotherapeutic agent and deliver the payload at the site of the lesion and activates an immunogenic response and cell death. So it is an innovative, cutting-edge technology and an innovation combination product, which is an investigational new drug, bringing to market a new use for doxorubicin.
So where are you right now in terms of development, pre-marketing, that sort of thing?
So we are in a phase 2 study. We have a phase 2 study that started in the summer of last year, a 60-patient, double-blinded, triple-arm, placebo-controlled study, which is now being conducted in 9 sites across the United States. We had in March of this year had given an interim analysis which is trending positively. It has shown us more than 60% of clinical clearance, which validated our belief in this asset. Our belief stemmed from the phase 1 study that was completed sometime in 2021, which was a safety study, but in that safety study, 6 patients also showed complete clinical response on histological examination in the nodular type of basal cell carcinoma. So we are very bullish that we are onto a disruptor that can challenge Mohs surgery. That is an expensive procedure, comes at a cost of $15 billion annually in the United States. And we have now expanded our cohort from 60 patients to 90 patients and are taking this trial beyond the shores of the United States in 2 sites in Europe, and also separately have a 36-patient study that is commencing patient recruitment with Cleveland Clinic, Abu Dhabi, and American Hospital, Dubai. Basal cell is not just an American problem, it's a global problem, and it comes in staggering numbers. So we are very excited with the advancements that we are making.
What's the advantage of this microneedle array? How does this sort of like compare to the standard of care, and what, you said it kind of it replaces or hopefully makes surgery unnecessary. Yeah, talk to me about how this could change practice if you get through your trials.
So non-melanoma skin diseases, particularly basal cell carcinoma, the incidence is about 5 million cases in the United States. And the only effective treatment is surgical intervention, also called Mohs surgery. And there are only about 1 million Mohs procedures uh, can happen in every year. There are only 5,000 trained Mohs surgeons. So at a given time, there are 7 million patients that are waiting in the queue to access an effective treatment. Mohs by itself is effective, but it is expensive, it is painful, and aesthetically not very pleasing. But our microneedle array based delivery product not only is meant to disrupt Mohs, but also complemented in the manner how we have designed our study program. You get diagnosed with basal cell today. You can the earliest you get scheduled for surgery is 8, 10 weeks out. Usually it is few months, but you can opt to in an office setting use our patch for 30 minutes by the physician or physician extender, come back on day 7 and then day 14 to have 2 additional sittings. And if in by week 5 or 6, upon visual examination, the lesion has been is clean, well then you are deemed cured post commercialization or post FDA approval, and you don't have to get more surgery done. But if somehow you are in that 40% bracket, because right now our clinical clearance is greater than 60%, you still go on and get Mohs done. So it does not it helps complement and strengthen a better patient outcome. So not only that it is cost effective, it is relatively painless and aesthetically more pleasing, but does not really create cannibalization of Mohs at the right out of the gates. But hopefully over time, not only Mohs, it will should replace Mohs, but also it creates access to treatment beyond the shores of the United States. So it is a form of just making it readily available at the grassroots level around the world.
Because you have that limited number of surgeons who can do that surgery. So
that is correct. Not only that they are limited in the Western Hemisphere, but in the rest of the world, they don't even have the sophistication of this of most surgeons doing this most procedures. So this is an effort to democratize the treatment regimen and uh, improve patient outcome.
So we're probably close to time, but I want to just give you a chance to step back a little bit. It's day 3. What have you seen so far at the show that's interesting? What are some of the kind of trends that you've come here to sort of learn about?
Well, we essentially have seen a lot of interest in our company and in our Skinjet asset. We also have recently announced an intent to acquire a UK-based company that is advancing the clinical development program of next generation GnRH antagonist, Tavarelix. There is a novel indication for prevention of acute urinary retention relapse and a treatment for advanced prostate cancer for patients with high cardiovascular risk profile. So while the predominant interest that we saw was in the Skinjet or this microneedle array platform, where it can be used for beyond non-melanoma skin diseases, but we saw reasonable high interest in the GnRH antagonist for these two other indications. So we feel that there is excitement generally around drug development process. The biotech sector has been in the nuclear winter for these past a few years, but these clouds are shedding, and clearly I have seen more action here than there was in San Diego last year. So all in all, we return very optimistic of our outlook and generally the outlook of the industry.
Awesome. Well, thanks so much for talking to me, Dr. Bokhari. I really appreciate it.
Thank you, Jonah, for having us on your program.